Please mention in the chat box. So today's topic will be CSSD, Central Sterile Department, Sterile Supply Department. Those who have the textbook, you can mention the page number in the chat box. If anyone is joining late, please help them out with the page number. It's a chapter after biomedical waste management. Page number 148. So Central Sterile Supply Department, CSSD, is the service responsible for receiving, storing, processing, distributing, and controlling the professional supplies and equipments, both non-sterile and sterile, for all the user unit of hospital for the care and safety of patient under strict quality control. Okay, they have to supply sterile, they receive non-sterile. Okay, receiving, sorting, processing, distributing, controlling. These all are the major functions that the CSSD has to do. Okay, and their main purpose is to provide all the required sterile items in order to meet the needs of patient care areas. Okay, anywhere in the hospital where patient care is done, any department associated with patient care will receive processed sterile supply from the CSSD, and they will give back non-sterile or used articles to the CSSD after proper decontamination. Okay. So this is the cycle. For example, if it is an operation theater, after using on patient or outpatient department, after using it on the patient, the any article that has been used on the patient, primarily preliminary disinfection will be done. Okay. First thing is the preliminary disinfection that they will do, and then that is decontamination. Okay, and they will send it to the CSSD. They will receive, the logistics will receive the articles. They will count what they have received. Was there anything missing, broken, or anything? Okay, that will be done in the logistics department. Okay, they will receive, they will check the article, what it is it broken? Okay, uh, and what is the count of the article per kit if you are giving a kit back to the CSSD. Washing will be done by them, and the CSSD will wash the articles that they have received, either manual cleaning or automated washers. Okay, and they will pack the articles that will undergo autoclave or hot air oven. Okay, appropriate packaging, either using cloth or paper, and then sterilization will be done depending upon the type of the article. Not every article can undergo autoclave. Okay, heat labile instruments will have to undergo methylene oxide treatment. Okay, or pyrolysis and all. Okay, and finally they will do delivery whenever it is issued. Then they will issue the logistics as well, which department has got what kit. Okay, and the cycle goes on. This is the cycle of CSSD. Okay, so items that are supplied by CSSD, instruments pack for various procedures, dressing pads, dressing packs, cotton, gauze piece. Okay, these all are the items that are supplied by CSSD. Zones of CSSD: soiled zone, contaminated supplies that are received, sorted, and decontaminated. That is the first zone. So all the unclean articles are received here. Non-sterile unclean articles are received here. That is why it is called soiled zone. Okay. And then clean zone, here inspection will be done, assembly will be done, packaging will be done. They are clean, but they are not sterile. They are yet to undergo the procedure. Okay. And after the sterilization is done, after the processing is done, you will keep the article in the sterile zone. Here storing will be done. Okay. Limited access area. Only the staff who are supposed to enter the sterile zone, only they are allowed to enter. Okay. Then post-sterilization, following steps should be considered. Sterile supplies should not be stored under sinks or places that are prone to be wet, okay, that may get wet. Always keep the articles in areas where they will be dry, away from the moisture. Wet sterile items are considered contaminated. Do not use it, okay? If you see a water pool inside the sterile item, consider that as contaminated, okay? Because moisture will breed microorganism. Cannot use it. Even if it is a recent moisture pool, you have to consider it as contaminated and give it back to the CSSD for re-sterilization. Closed or covered cabinets are ideal. Don't keep it in open shelf. Open shelf can be used if you don't have any other option. Open shelves can be used, but ideally closed covered cabinets are the first option. Fallen or dropped supplies must be inspected. If at all anything falls off, falls down, it has to be inspected. Intact heel seal, it means it should, if the heel seal is intact, it means it's not contaminated, it can be used. But if the seal comes out, okay, if the seal is open, consider that as contaminated. Then collection of distribution of items, all items should be collected and distributed twice a day at least from the CSD department. That's their protocol. Ensure secure transportation methods to ward using CSSD trolleys and all, so that while getting it to the ward, it should not meet with some it should not hit some other articles, and things that are inside should fall off. Okay. Record each items collected back from the patient care areas to have a record that if there was any loss, who will incur the loss? Is it the department which is responsible, user department? Okay. Check expiry days, return supplies to CSSD if crossed expiration. Then record each items collected back that mentioned. Expiry dates should be checked. Then monitoring sterilization. You have two indicators, okay, chemical indicators and microbiological surveillance or microbiological indicator. Because after a sterilization is done, just by looking at it, you cannot be sure of, okay. you have to, it should be an evidence-based surety that the sterilization process that has been done, autoclave or hot air oven, it was successful. Okay. So what will give you that surety? So you will have to use these indicators, either chemical indicator or microbiological indicators, to get that surety that the process that you have done, the sterilization that you have done was completed. So in chemical indicator, this is an autoclave tape. Okay. Before applying, it will look this beige and white striped tape. And after the autoclave is done, it becomes this black and white tape. You can see this. If this is the color change from this color, this beige and white color, if it is converting into black and white, okay, it means it was successful. If it is patchy, if the color does not change into black and white, means the sterilization was not successful. Okay, so this is one chemical indicator. This is an example of a microbiological surveillance. Bacillus stereothermophilus spore is used. Bacillus stereothermophilus spore, which is a bacteria. Okay, and when you autoclave the articles, along with that, these vials are also put in. Okay, so once you remove the tray from the autoclave and you check these vials, it should completely turn its color to this yellow color. Okay, from this light purple violet, it completely turned into yellow. Okay, which means the sterilization was successful. Okay, positive result. This is a positive result, means the sterilization was successful. But if the color does not change much, and if it is cloudy like this, you can see in this last image, if the color change is cloudy and it's not yellow, it means negative, means your sterilization was not proper. Okay, you have to re-sterile everything that has gone in that load. Okay, this is the microbiological surveillance. So recommended practice guidelines for all types of steam sterilizers. Device preparation. Before sterilization, you have to check that if the item is working, if the breakdown maintenance, prevention maintenance was done. Okay, if it is in proper functioning method. Is there any overload? Okay, what is the capacity? These all things you have to check. Okay, before putting things into the devices used for sterilization. And packaging, there are some specific cloth and specific fiber materials used for packaging the article. Everything that goes into autoclave should be packaged. If it is not packaged, it is not considered sterile. Okay. Then unloading. While unloading, you have to cool down the article. Okay. While unloading, you have to check for the chemical indicator, microbiological indicator, if the autoclave was successful or not. Okay. Make sure that nothing falls off while unloading is done. Then load cool down, specifically when it is hot air oven. If you're using hot air oven, immediately when the sterilization is done, don't open the doors of the hot air oven. Okay, you have to allow it to cool down and then open the doors. Otherwise, sudden gush of cold air from the room into the hot air oven, glasses and everything will break. Okay. Troubleshooting, if at all there is any wet pack problems. Okay, there is a moisture pool or water pool that has accumulated in the sterilized or packaged article. So that is a wet pack problem. So troubleshooting has to be done. Some preventive management has to be done for the device that has sterilized it. Immediately, if the water pool is present in the sterile kit, okay, do not use it. Immediately put it back again for the next load for sterilization. Don't use it again. Then flash sterilization, usually done in benchtop, autoclave and all, in which packaging and all is not required. But if you're doing flash sterilization, immediately after within 30 minutes or 1 hour, you have to use the article. Okay. Usually we do this in ICUs and emergency department, where you can't wait for things from the CSSD to come. In case of emergency, you can't wait for them to arrive. Okay, so flash sterilization helps 15 minutes sterilization can be achieved, and immediately the article has to be used. Okay, you can't keep it like otherwise. Autoclaved articles, hot air oven articles can be kept. They have a shelf life. Okay, but after flash sterilization, articles cannot be stored. Within 30 minutes, you have to use the sterilized article. And quality assurance is done. There are protocols that the quality officers have to follow for CSSD. Okay, from the maintenance, from the device maintenance, the procedure, the process, okay, the uniformity, okay, the number of unsterile articles coming back, okay, errors that is happening in sterilization, those all has to be checked. That is quality assurance. There is a recall procedure as well. If at all you have already distributed the article after sterilization, it has already reached the nursing department or reserve units and other departments of the hospital, and later you understood that it was not sterile. How do you bring those articles back to the CSSD before it get used? Immediately you have to call the nursing superintendent. Okay, nursing superintendent has to be called. He or she will inform the department heads, the department nurses, staff nurses, in charges, and they will check the load number, because you have to give the information which load number on which day, the article that has arrived on which day, which load number are considered unsterile. Okay, that information has to be passed. It will be passed on to the award in charges, and they will check their inventory. All the items that have the similar load number will be sent back, okay, to the CSSD. So that is the recall procedure. We have this Bowie-Dick indicator as well. Just like the chemical indicator, Bowie-Dick indicator also tells you if the sterilization was completed, it was proper or not. Okay, so it comes in this yellow and white stripes. Okay, Bowie-Dick indicator. This tape you will apply on the unsterile article, put it for sterilization. After it comes out, it has to, all this yellow and white has to convert into black and white stripes. It means a proper sterilization cycle was achieved. Adequately, the articles have been sterilized. But if there are yellow patches like this, okay, patchy appearance on this Bowie-Dick indicator, means the sterilization was not good, not adequate. Okay, again, resize sterilization has to be done, or the device's maintenance has to be done. Okay, autoclave has to undergo any form of maintenance. Okay, so that's about CSSD. If you have any queries, you can mention in the chat box.